for joining us. I'm super excited that you guys are here. We're talking about everything body prep, getting ready for pregnancy, getting ready for conception. So we're going to start by just welcoming you. I want to talk about some of the reasons you maybe signed up for this workshop here. So you might be feeling ready to have your first kid, but don't actually know where to start. So you are in a good place because we are going to hook you up with a lot of knowledge that we wish every mom would learn and know about before. And that is one of the biggest things that we hear from a lot of our patients is like, I wish I knew about this stuff before I got pregnant or before I ended up delivering. So we're excited to be able to give you this information preventatively and in preparation of getting pregnant. So this might be for you if you have been trying to conceive for a while and you're just looking for additional support. This will definitely maybe shed some new light on different opportunities on how to prepare your body and some different routes of helping you improve and enhance kind of the body you have to support the fertility journey. And then this is definitely for you if you're wanting to have a child, like a second child. A lot of moms also tell us that they are a little hesitant to have a second child because of their experience with birth the first go around. And maybe they just felt like incapacitated after that delivery and had a hard time caring for a child and are worried about maybe caring for a second child because the recovery was so tough, or just the birth process in general. It can be traumatizing, and really knowing what's happening to your body and preparing for that journey of birth and delivery and just knowing beforehand. Knowledge is power and can really help minimize some of that trauma. So this is for you if that is the case. And then really just if you are just looking for more information, this is absolutely going to give you that. So thank you for being here. We'll talk a little bit about your pelvic floor, preparing the pelvic floor for pregnancy, optimizing your fertility, and then we'll talk about how to strengthen and coordinate your core and support your joints. And then we'll talk a little bit about organs as well. To get started, this is your pelvic floor. Okay, so the pelvic floor is made up of 3 different layers of muscles and fascia, and they help support your organs. And it is really important that this muscle has good blood flow, that this muscle can contract, relax, and bulge. Okay, so this is optimal positioning of your pelvic floor. So I'm sure you guys have all heard pelvic floor or heard that word before, but if you haven't, the pelvic floor encompasses the anus, the vagina, and the urethra, and the clitoris. So it's involved in a lot of functions. And then, through the vagina, that's intercourse, how you get pregnant. Okay, so these muscles are super important in just your ability to participate in sex in the first place. And when you are thinking about getting pregnant, if you go into your pregnancy with the ability to control these muscles, it can change your entire outcome. It can change your whole pregnancy. It can change your delivery, and really enhance your recovery. So the more you know how to control your pelvic floor, the better optimized you'll be. But also just having movement here can play a huge role in improving fertility. So these are some of the issues that can show you if your pelvic floor isn't necessarily as happy as you want it to be. So sometimes pelvic floor issues show up as low back pain, achy hips, knee pain, stiff necks, painful intercourse. So maybe that's with different positions, it doesn't feel right. Those are actually signs that your pelvic floor might be too tight, or there might be shifting in your pelvic floor. That just means that the muscle itself isn't as healthy as it could be. And so that's what these lists of symptoms are, or lists of diagnoses. Inability to orgasm. So a lot of people will tell us sex, first off, has never been that comfortable. I've never really been able to enjoy it. And maybe they have a really hard time getting an orgasm. Maybe that orgasm is painful, or maybe it's not a problem at all. But these are just some of the things that people will report, and that will just tell us that there is something going on. There is dysfunction in the pelvic floor. leaking urine. So if you are doing double unders at CrossFit and you leak, that's showing us that you're having dysfunction in the pelvic floor. There's also like if you can't control your gas, or if you have fecal incontinence or constipation, so you're maybe pooping when you fart sometimes, that can be a sign of pelvic floor dysfunction, along with constipation. So constipation or bloating. I think I already said the constipation part, but these are all signs that like could relate back to your pelvic floor, and just, you should go through the list and say like, okay, if I have this, my hips have always been tight, then that would be a sign like, yes, get your pelvic floor checked before you even start getting pregnant or becoming pregnant. Or if you are early pregnancy, definitely hit up a pelvic expert physical therapist so you can get just get an assessment. And that's pretty much what I wanted to put these general symptoms on. Really, anyone who can get an assessment pre-pregnancy of their pelvic floor it would be ideal. And that would be awesome if every woman got to have that experience, because then that can really teach you the control that you want to be able to have inside your pelvic floor. So I just want to touch on this and just like talk about the benefits. If you are struggling with infertility, first-time infertility or secondary infertility, these are huge things that we see in our practice. And obviously, this is just one element of the pelvic floor, and like manual pelvic floor physical therapy is one element, and a really important element that can help enhance your fertility journey. And there's been evidence that show that pelvic floor physical therapy can change the mechanics of the organs. So I'm going to just back up here. If I'm a uterus, I hope you can see me. Could someone just chat if like they can actually see me, because I'm stepping away from my computer. In the chat box, can you see me? Can you see me? Yes. Okay, great. Thank you, Erica. Okay, so I'm a uterus, and these are my fallopian tubes. And then here we have some ovaries. Then my ovaries need to drop the egg and go down the fallopian tubes, and then implant in the uterus once the sperm hits the egg, right? And so, but that all takes movement. And so sometimes, a lot of times, people freeze and their organs become very stiff and fibrotic. And you can get different adhesions inside your organs. Adhesions are these little fibrous molecules that lay down in your abdomen, in your pelvic floor, and kind of all around it's called endopelvic fascia. So everything that encompasses the organs, that are reproductive organs, and those adhesions and sometimes just tightness in general can lay down in response to trauma, in response to inflammation, in response to stress. And so these are all things that can like freeze these organs, and they can have a huge effect on fertility. So scar tissue is also a major player here. So I kind of listed this out. Manual soft tissue therapy can really help facilitate fertility, decreasing these adhesions and improving the movement and mobility, which therefore can enhance your ability to get pregnant. And so it's awesome, even if you're not having trouble getting pregnant, then just to get this checked out, like kind of see where you're at, because dealing with this even during pregnancy is beneficial in preparing for a delivery. So if at all possible, I love to preach this, getting checked before pregnancy, and really it having a positive effect on your fertility journey, which is what the evidence shows us, which is pretty darn cool. And in women that have had IVF and IUI, when it's combined with soft tissue manual therapy, the success rates are much higher. And I think it's like in the this article, this Warren et al. Article, I think it's like a 60% improvement. Don't quote me on that. I can't remember the stat, but it's huge. So soft tissue manual physical therapy. So that's like intravaginal and abdominal releases can really have a huge impact in enhancing the fertility journey. So that's what I'm going to say about that. Questions questions as we go in the chat. But yeah, Tejal, I agree. Like, no one tells us this, but this is the evidence. Like, there's many lists of articles. And yeah, it's interesting. I don't know any fertility specialists that are referring to pelvic floor. I know like some people will refer to acupuncture and chiropractic care to assist with fertility. And I don't know the evidence surrounding those mediums of practice, but I know people that have had success using them. But clinically, what we see here in the clinic supports this evidence like beyond belief. And if you were in any of our emails before this, you saw some of the success stories, and it's pretty cool. So that's what I'll say about that. And I know I kind of mentioned scar tissue, but I'm just going to touch on like previous C-sections really quick. So if you had had a C-section and then are hoping to have a VBAC or a vaginal delivery, then that can be really assistive in helping release scar tissue preemptively as well. So, and that can be part of the pelvic adhesions and the abdominal wall adhesions that can, if you minimize them even before conception, can have a huge impact on not only fertility, but delivery and like your desire to have that VBAC. Okay, some questions in the chart. Thank you guys for asking questions. It's so fun like this. What is soft tissue manual therapy? There are a ton of tools that we use to assess the abdominal wall. So we have different techniques called visceral manipulation, where we move some organs around, do some different stimulating organ massages, and just get things moving in that regard. We assess scar tissue. And then we also do intravaginal assessments. So when we talk about like what is a pelvic floor assessment, it's the same way we actually treat it. So it would be doing manual work. It's almost like, it sounds funny, but it's almost a massage for your perineum, but on all the layers and kind of checking every single muscle. So there's a lot more muscles inside the pelvic floor. I mentioned the 3 layers briefly, but they're composed of multiple layers of, multiple muscles in each layer. So it's like manual releases include like holding the adhesion or moving the adhesion around. And what we hope for is called remodeling of the tissue, which then allow the normal collagen fibers to lay down. So when you have really fibrous adhesions, the goal is then to help remodel that tissue. Linz, does that make sense? Did that answer the question enough? And you can kind of chat back to me, but I'm happy to go further into that too. I hope that answered some questions there. And yes, I agree, Christy. No one utilizes pelvic floor PT. We can only hope. That's why we're here. And I need to keep watching the participants. So I will keep admitting people. Sorry for the delay on getting admitted. So part of like waking up the abdominal wall, waking up the pelvic floor to improve this blood flow to the organs, improve the quality of the pelvic floor tissue, is to learn how to, after those like manual releases are super important really for everybody with tightness. And you hear very rarely, like most people are like, oh, I need to do Kegels. But I will tell you, like most women that we treat, we usually have to teach them the reverse Kegel first. Like they are just stuck in this like Kegel contracted position and actually don't know how to relax. And part of that then develops adhesions in that tissue because they're constantly contracted. And so the where we're going to go next is just talk about like what does it look like to strengthen and coordinate your core. And I'm going to touch on connecting to your pelvic floor, the quality of the pelvic floor. So when we're touching the tissue of the pelvic floor, and we're doing internal assessments and releases, we want that tissue to feel like soft and mobile. And sometimes when the muscle stays in that contracted spots or there's adhesions in the muscle, it becomes more dehydrated. It becomes less flexible, less elastic, which leads to things like painful intercourse or incontinence, peeing when you don't want to be peeing, inability to have an orgasm, or low back pain. And so sometimes when we describe the tissue, it can literally turn into like what feels like beef jerky just from not using it. And so it is important to get that quality of the pelvic floor. And that's where the manual therapy can really make huge improvements there. So then we get to strengthening and coordinating. And when we talk about that, we're talking about, so this is what is considered your core. And this is what expands massively throughout entirety of pregnancy. But if you can get this really strong and coordinated and healthy before you get pregnant, then you can keep it strong and healthy throughout your pregnancy. And that's where a lot of people have a hard time. So I'm going to teach you like a couple really important things that you could just start now. At first, I'm just going to describe this. So like a healthy core is like a pop can. And this is an example. I don't think she's in the references, from a physical therapist, Mary Massery. And if you follow us on Instagram, you'll see this in one of our posts. So what this is a pop can. Okay. So the top of the pop can, as you can see on the screen, is your diaphragm. Okay. So this is your core. The screen, the left-hand side of your screen is the diaphragm. The front of the wall is your abdominal, the front of the pop can is your abdominal wall. The bottom is your pelvic floor, and the back is your multifidi, and I also add glutes into that. And all of those muscles have to be coordinated, and when they're coordinated, they maintain this super awesome pressure, which makes it so you cannot squish the pop can, and that's how solid you want your core. You want it so your core can't squish. Therefore, it's supporting your knees, your hips, your low back, all of your joints. But if you have dysfunction or you're not very strong in some of these muscles, it's like opening the pop can and all of a sudden you lose your internal pressure. Okay, so I'm going to take a sip. So one thing that is really important about that internal pressure when your core is strong is that inside that pressure, your organs can float and move freely. And so part of that, like getting this like strong core, is having the balance of these floating and moving freely organs. So what that does is supports the fertility journey, and from the research shows mobility is definitely needed and enhanced with manual therapy to help with the fertility journey. So that is your abdominal wall. I'm going to teach you 2 techniques that's important to start using it, actually 3. Okay, so one of the first ways to start connecting to your core is by utilizing the very top part of the pop can, which is your diaphragm. And so this is how you're going to start connecting to your core, and that in turn is going to improve your pelvic health and improve your blood flow to all your pelvic organs, okay? So the very first thing we will do is some breath work. So I'm going to stand up here. Hopefully you can see me again because I will stand in the same spot. If you take one hand and put it on your belly, the other hand put it on your chest, you take a deep breath into your belly. That is a diaphragmatic breath, okay? The goal is that the air descends into belly. You might get a little bit of rib expansion. People will tell you different types of breathing patterns. Different Pilates breaths are going to focus more on the lateral expansion of the ribs. So like breathing into your ribs, and more yoga practices will tell you to breathe into your belly. I'm telling you, for your pelvic floor, blood flow, and health, to start working on breathing into your belly. All of them are good, but right now for like preparing for your pregnancy, this also has a huge impact in preparing for delivery, is to start breathing nice and deeply into your belly. I say 5 minutes a day. What you want to start coordinating this with is opening your pelvic floor. So because most of us live in this contracted Kegel-like position and don't need to be doing Kegels, and I will say that again, most people need to be on the anti-Kegel diet and don't need to be doing Kegels. And so hopefully that's like a newsflash for everybody. And so the breath work is going to help you do a reverse Kegel. So you are contracting your diaphragm. As you contract your diaphragm, it descends into your belly. So it's in a diaphragmatic breath. So that's number 1. Spend 5 minutes a day doing that. And that is going to really help a lot of things. And if that's the one thing you do before you get pregnant, that's amazing, because during pregnancy, your ribs are going to flare and your diaphragm actually gets weaker. And so it's a good tool to keep strong throughout the entirety of your pregnancy. It sounds silly, but try to commit to it and try to start doing it, and you will notice improvement in that very top muscle. And so that's the first part. The second part, like I said, is starting to connect that to opening up the pelvic floor. So in order to help feel yourself open the pelvic floor, you might need to do a little squeeze, okay? You might need to start like by seeing if you can like close your labia. But like I said, most people are already in that contracted place and already feel like they can't go much further. So working on opening or flaring open the anus can actually have a great impact. I know it's a funny visual, but that's what this is the reality of the pelvic floor. So as far as inhaling, doing that diaphragmatic breath, you can now pair it with thinking about opening your anus and opening pelvic floor. So you want your pelvic floor to open at the same time that your diaphragm descends into your belly. A strong and healthy core has this spring-like effect, okay? So all these muscles can like be like a spring and be shock absorbing muscles. But most times we live like with our abdominal walls super tight and we just walk around like this all day. Our pelvic floor is nice and tight. And then we want to get pregnant, but everything is so like tight and rigid and organs don't move when things are tight and rigid. So hopefully that's a little bit helpful in just like getting ready to start preparing your core. I'm going to give you one other muscle that, in my opinion, is really important that you learn how to start activating before you get pregnant, because this can help prevent a diastasis. So that's that abdominal, you might not have known of that, but that is when you get like an abdominal separation during pregnancy. So people might say like, I have a mommy tummy, or like my abs are separated. And so this would be preventative for that. This is preventative for low back pain. And that is learning how to contract your transverse abdominis muscle. And so I like to explain this as if you have your hands on your pubic bone or right above your pubic bone, that's your bladder. You think about lifting your bladder up towards your belly button. And then letting it go and seeing if you can hold that without squeezing any other muscle in your body. Just starting to activate that muscle is going to give you the front part of your pop can. And you're going to have to come see us for the back part. No, just kidding. When but you really should come see us. But when you start to activate that muscle, when you start to activate that front muscle, that is going to give you overflow to your multifidi, to your glutes, when you do more functional movement. It gets a little bit trickier, but all I'm going to say, if you do those three things, you are going to be more set up than anyone who gets pregnant, because that is what we end up having to teach. And we only hope that we can give that to women before they get pregnant, so they can start doing that throughout the entirety of their pregnancy, but also just to help with their fertility journey. And if they are struggling to get pregnant, I didn't mention this, but I thought this was really interesting. In the US, we consider infertility as having unprotected sex for 12 months without the result of a pregnancy. And in every other country, it's 24 months. So we are like the want it now country. And I totally get it, because when I want to have a baby, I want to have a baby and I want to have it now. But as far as like from like a fertility journey perspective, just giving yourself grace is super important. And again, like this is just one medium. There are many people who can help you on your fertility journey, and across multiple mediums beyond healthcare as well. And so it's worth saying that. And if you listen to our podcast, you'll see some other people who help with that fertility journey that are completely outside of medical world. But I just thought I would drop that. So, okay. So that is getting connected to your pelvic floor. Okay. Lynn's asked, can manual therapy be done when you're already pregnant? Absolutely. It is something that we train throughout the entire pregnancy. Not as frequent if you're connected to your core or you don't have it as many adhesions. We'll do it more from a stretching perspective or preparing for a vaginal birth. So that's amazing. And that we have awesome effects on first-time moms having less tearing or no tearing at all, and really successful VBACs as well. So definitely training during pregnancy is super awesome and super important. And the manual therapy portion while pregnant, we can't do that in the first 12 weeks, but the internal stuff we can do after 12 weeks. Everything external. There's a lot of external pelvic opening techniques that we do to prepare for birth. Those can all be done right away And Tejal, you love the pop can analogy. Awesome. Krista asks, how long do you recommend doing these exercises before trying to conceive? Well, that's a great question. It takes 6 to 8 weeks to like change muscle strength. So that's kind of the guideline for changing strength. It takes 2 weeks to change coordination. So neuromuscular connection to muscles, which is coordination. So your ability to have that pattern takes 2 weeks. So maybe just 2 weeks to start seeing your strength changes, maybe 6 to 8 weeks. But I would like, we see pretty awesome results within just like a couple weeks of doing this work. And doing that breath pattern, that can be huge. So hopefully, Krista, that helped. If someone has a miscarriage, how soon after is it recommended to start PT? It would be once they're done with that miscarriage. So it's similar to the guidelines for postpartum rehab, 6 to 8 weeks, as long as the bleeding has stopped or the alopecia has stopped. So hopefully that answers your question. And Tejal, as far as like a miscarriage goes, if it was a DNC or just without DNC, so if you had to have assistance to remove everything, you would like, that's more trauma to the tissue. So definitely adhesions can appear and happen. And so we can definitely help with that. And a miscarriage is trauma to the tissue, just like a birth, whether it was like a completely vaginal birth, no tearing, it's still overstretching of the tissue. So you can develop, even if you don't tear, you can develop adhesions throughout the pelvic floor after a vaginal birth too. So it's important to get back connected to your pelvic floor before even going to an exercise routine or like filtering back into your exercise routine. But that's more of our postpartum talks. But hopefully that answered. Cool. Thanks, guys. It's fun chatting with you. And it's fun being interactive. So thank you for your questions. Okay, so this stuff I'm just going to touch on. So some people will come to us and they're doing CrossFit 5 days a week, which is awesome. And maybe they're doing HIIT 5 days a week or yoga every day. And really, it's like the biggest thing on your fertility journey, just as it would be during your pregnancy, is to have balance and to really let your body rest and recover. So doing HIIT Monday through Friday every day, or maybe just taking Wednesday off, is like a lot of stress on the system. So it's good to just filter it out. Maybe it's 3 days a week, and maybe you're filling that in with yoga practice and your mobility training. My recommendation to everybody is just like find the movement you love. So what is that movement? Is that stress-free? Whether that's playing a sport, going hiking, or is it going to CrossFit every day? And is there a way, if you do high intensity 15-mile hikes every day, or whenever you're doing 8-mile runs every day, is there a way that we can start to modify your activity so it's less stressful on your system? And it's so challenging. And this is not lost on me at all, because I live this and I am this too. Like, you want to be in the best shape of your life going into your pregnancy. So you think 5 days a week CrossFit is awesome, and you think like you need to make sure you lose the 20 pounds, and so you're going to bust your butt so you can just like do that. And I get that mindset, but like, again, just the stress of all of that, like, and body image is like a huge thing in our society. So yes, you want to start your pregnancy at your dream weight or whatever you think you need to do. But it's just like, I just hope that we can, as a society, start to change that mindset and just say like, hey, how can I be healthy and happy and ready for this pregnancy from a more like your core is coordinated regardless of what you weigh. You're in, your cardio is in good shape, and you are mobile, and you can do the things you want to do in your life. Like, to me, that is health. And that is like kind of the goal. But I get thinking that you need to lose 20 pounds before you get knocked up. So I throw this out there because I want you to I want someone to tell you to give yourself some grace, because I know that the stress is real in all of this. So that's my soapbox for that. Cool. Welcome. So the next thing that I'm just going to chat on, just bring some stuff up from some research. Psychological stress. Really high cortisol levels can change can affect ovulation, so can affect the oocyte that's released. And so it is important, everyone says manage your psychological stress, and like it's so easy to say and like the hardest thing to accomplish it all. So you got to just find what works for you from that perspective. And then when you start going down the infertility pathways, the stress just skyrockets and spikes. So all of that is very real too. So finding your mojo, whether that's meditation, whether that is just going on some long walks or sitting at the beach, finding a way to be able to come down. This is so not research-based, my next recommendation, but oftentimes we have patients, and I myself will recommend this, I don't even think I should say this because it's not research-based, but just like as a stress management tool, just like I said, sitting at the beach, we have patients that will use spunk pads, so acupressure pads, and you can get those on Amazon. I guess this is a free promo for that. And that can just be like a nice way to come down after the long day, or if you are having stress, that can be like a nice way to manage anxiety. Not research-based or evidence-based, but we do have patients that benefit from that clinically. And so the next thing is smoking. So smoking definitely, there's a lot of research on how that can impact fertility negatively. And then alcohol and caffeine consumption. The research is really mixed on it affecting fertility. So really just everything in moderation. There's not like clear cut evidence that yes, alcohol is going to impact ovulation, or that caffeine is going to definitely change the hormone levels and plasma levels that can affect implantation. But it's just like everything in balance. So it's just one of the things, one of the lifestyle factors. So I thought I would put it on here. And then diet, you will find like all the diets in the world. And so that's what this is not about diet. And I'm like anti-diet to a T. So fruit and veggies in balance and finding what works for your body. But there is research on like inflammation affecting fertility. And so some people find that different foods make them feel more inflamed. And so avoiding those. And then there is evidence that saying exposure to electromagnetic fields can affect fertility. And then vitamins and antioxidants. So vitamin D and vitamin C have been shown to shorten the fertility journey. So shorten the time that conceiving takes, at least in women over 45. And those are easy supplements that a lot of people take anyways, but just as a side note. So if you want any of those articles directly, they'll be at the end of the presentation. So you can see what those are. Emily said, I was doing intense lifting 5 days a week and lost my period. I had to cut all intense exercise altogether to get it back. So yes, totally agree. Super stressful on your body and not necessarily compatible with the fertility journey. Yeah, Emily, and it's super hard because like you thrive and love lifting, because I love lifting too. And it's so hard to like balance that desire and drive and like hit that like mental hit endorphins that you get from that kind of workout to like, okay, yes, I want this family. I want to go down this path, and like finding that balance is just hard. So working with someone is definitely helpful and beneficial to just kind of like talk you down out of your patterns. So yes, and Amelia, I said spunk is an acupressure mat. Yep. So as a de-stressor, that's just a tool for de-stressing if that's what helps you. It's not for everybody, that's for sure. But let's see the next slide. So pelvic floor physical therapy can help you prepare for pregnancy. So kind of just some like recap some stuff we talked about here. So improving the quality of your pelvic floor, kind of taking that like tightness, melting it, turning it into more of like a steak-like mentality, steak-like quality from beef jerky. I know it's not beautiful, and I'm so sorry if like you can't handle that analogy. I've tried a million times to think of something nicer. I've thought about but nothing describes it quite so perfectly. And there's different levels of that. And the only other thing I can think of is like bacon, but that doesn't do it justice. So really improving the quality of the pelvic floor, decreasing the adhesions, muscle tension, trigger points, decreasing scar tissue. And just because you have not had a baby doesn't mean you don't have these things. And so it is good just to get checked and kind of see where you are. Constipation and bloating and GI symptoms are huge in women in their 30s, late 20s to 30s. And yes, food you eat has a huge effect, but our organ motility of the colon can also play a huge role in bloating and constipation. So getting your organs moving healthy can really, really improve constipation, and improving constipation can really, really enhance fertility and really improve that journey. So, and that's improving movement of your pelvic organs. So colon being one of them. And then learning how to work your core and pelvic floor, like we kind of chatted about. And all of this stuff, like doing this preconception, this is the reason I'm giving this webinar, is because I just feel like it's missing. Like no one talks about like what your body should or could be doing in order to really help prepare for a pregnancy. It's just not out there. You just know that you maybe want to have another baby, or maybe you don't even know. And if you, and so whatever that is for you, like it is just so important to start learning how to use these tools. And if you can use them now, it's just going to impact you. So the benefit throughout your pregnancy is going to be massive, and really through delivery. So that is that. So like I said, just preparing for conception and pregnancy and delivery, like tenfold helps the postpartum journey from a physical healing standpoint. Obviously, there's many other factors in becoming a mom and changing your identity and all of these things. But from a physical standpoint, where a lot of people find their energy and their mojo, this can have a huge impact. So that is my soapbox. Thank you for joining. And I really hope you got some information from this. We offer free consultations right now with Dr. Riley and myself. Mm-hmm. Okay, Linz, you're still confused about the reverse Kegel. Totally. That is a good question. So if your pelvic floor, hopefully you can see me here. Okay. Yeah. If your pelvic floor is your bicep, so this is a bicep muscle and this is a bicep lengthened. When you contract your bicep, you're contracting. When you lengthen, you're lengthening or relaxing your bicep. The pelvic floor tends to live, not for everybody, but for a lot of people we see, the common practice is for the pelvic floor to live in this contracted or semi-contracted position, okay? And so when you already are in this contracted position, it's really hard to contract any further. And so therefore we work on opening more. And so if the pelvic floor is a bowl and this is your pelvic floor, we're working on opening your pelvic floor. So it can be really hard to feel. A lot of people have a hard time connecting to this. So this is why pelvic expert physical therapists exist, is really to help guide you through learning how to use these muscles and kind of seeing how they're moving. So there's a lot of things we can do, and we can do that from a distance too, through telehealth. Great. Well, thank you guys. This was such a fun way to spend like one of our only summer nights in Seattle. So I super appreciate you being here, and we'll send this out, and please feel free to email us. We are happy to answer questions or be a support or resource for anybody in the community. Even if it's not you and it's your friend or whatever, we're just happy to like spread the word. We also have Body Motion Moms. So feel free to join that group on Facebook. And I talk about crazy things on there, like different sex positions and how to feel comfortable in different positions. So, and also different core exercises. So please join. And we are so glad you joined us tonight. Have a good night, you guys.
The Edmonds Mom's Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.